Hi everyone, this is Dr. Fred Macy. So the topic today is male hormones. As many of you know, a lot of men experience erectile dysfunction. Just as a rule of thumb, if you're 40, you have about a 40% probability today of having erectile dysfunction. If you're 50, 50%. If you're 60, 60%. 70, you get the point, 70%. So I see a lot of patients who come in very shy about this topic because it's rather sensitive. I do bring it up because I tell them I'm not moralizing, I'm not being judgmental. It's a cardiovascular issue 90% of the time. And there are multiple reasons why your testicles may not be functioning optimally. So if you have this issue, and on top of that, you have hypertension, prediabetes, diabetes, cholesterol issues, and some excess weight, I'm going to do a comprehensive evaluation. I'm going to check your complete labs, including your blood counts, your kidney function, your liver function, your thyroid level, of course, your hemoglobin A1C, to see where you are on the spectrum of diabetes or prediabetes. And lastly, your smoking status. And I'm also going to look for your hormones, your total testosterone, your free testosterone, your estradiol, etc. Once I have all of that, then I'm going to provide you with a comprehensive plan that will in all likelihood start with lifestyle modification. That is, the appropriate diet, mostly plant-based. And in some men, I'm going to probably recommend that you avoid certain foods that contain estrogen, such as soy, and also dairy products, since unfortunately, the dairy industry, all too frequently in the United States, adds various added agents to the food, to the cows, and they get injected with hormones, and they get antibiotics and other substances that are deleterious to your own testosterone. So once we do all of that, then if your testosterone is low and you don't have any other issues that may be cause for concern, I would probably recommend hormone replacement therapy, at least for the next 3 to 6 months, or perhaps even up to a year. This will help you build muscle, shed some excess weight, hopefully get your mood a little bit better, meaning your libido. And if you're trying to have children, this may actually help you increase your sperm count. If you do not have children and wish to have a family, and you have been trying to conceive, say for a period of 1 year or more, then I may need to get your actual sperm count, and then I can devise a specific strategy to treat that issue. And that may involve some HCG as well as a testosterone, or possibly clomiphene or clomid as needed for specific cases. So this journey requires a lot of detective work, a lot of adherence to treatment, specifically the lifestyle, and hormones that may be indicated. The testosterone may be given in injections, in pellets, as a gel that you apply, and we have now an oral medication. Some of these may be covered by your insurance, others may not. It depends on your particular coverage, and some are expensive. So for most patients, a once-a-week injection usually does the job. So each individual has their own particular needs, their own particular circumstances that have to be evaluated in depth, and their own particular follow-up. Why? Because we don't want to have complications with your red blood cell mass that may be increased by testosterone use, or issues related to the prostate, or other issues related to inflammation of the liver, or lastly, too much conversion of the testosterone you're injecting into female hormone, estradiol. And that means you're going to have more tissue in your breast called gynecomastia. And so you may also put a little extra weight around the belly. So we have to navigate this with estrogen blockers. So again, each individual has to be evaluated one at a time and an appropriate plan advocated. So hopefully this has been helpful to all of you. And again, the last thing I'll say is, this isn't about giving you sildenafil or Viagra, or tadalafil or Cialis, or some other such agent. It requires a lot more, since it is a cardiovascular issue in about 90% of individuals. Thank you.